Hi everyone, Dr. Jay Mehta here. I lead the chronic pelvic pain and neuropelviology clinic, the first of its kind in India. What is chronic pelvic pain? Girls, remember one thing. If you are experiencing pain in the lower part of your abdomen, that is called as the pelvis. Even if it is intermittent, that means if we call it colloquially, it's ruk ruk ke. Or even if it is continuous, that means almost every day. But it has to be present at least for around 6 months for us to call it chronic pelvic pain. The word chronic here is very important. It's very disturbing, breaking, shattering. It affects the quality of your life. It affects your mind. That is the reason why we have a dedicated chronic pelvic pain clinic now, because it requires a thorough evaluation and then quite a lot of times management with the help of a multidisciplinary team, which can either be a surgical team or be a neurological team or be a physiotherapy team or be a counseling team. And in most of the situation, a combination of all of them, which is why we require a clinic like this in India. Also remember, girls, when you try to look at chronic pelvic pain, okay, the most common diagnosed cause in India is going to be endometriosis, adenomyosis, pelvic inflammation, some types of fibroids. And if all these four things are ruled out by an expert by doing a good ultrasound, then it will also point to other rare causes like post surgical adhesions, nerve entrapments, neuropathies, bladder pain, and in quite a lot of times, it will also stay idiopathic. That means no known cause available for this. This is exactly the reason. If somebody like this is a patient, then these patients require to visit a dedicated chronic pelvic pain clinic so that you can have a dedicated assessment of the entire procedure and then a final diagnosis and a final treatment.